The fact that you are able to sit in your room and tick all your contacts, and just by a single button you can forward a message. So in terms of how misinformation spreads, technology helps it.
Which of us here remembers or heard that myth? If you eat mango and drink Coke after.
You die.
What?
Coke and Gary.
Yes.
Yeah.
Coke and Gary and then mango.
Do you know, today that is still... For some reason, like, I know it doesn't make sense, but...
They see that fear.
They see that fear somehow, somewhere.
And
to be honest.
There's no a particular brand of mango then they use. He had ropes or something.
This is the Break It Down podcast, brought to you by Nigeria Health Watch, where we simplify complex health issues so that you can make sense of them and take action. As always, I am Asari Ndem.
And I am Chibuike Alagboso, your co-mayor, the Break It Down town.
Oh no!
Community.
I forgot my title.
Well, because it's not real. Like the main person that has the title wouldn't forget it.
Oh my gosh.
But anywho, next time please do remember.
I will remember, don't worry.
So today we are driving into a topic that has become a real public health emergency, and in its own right, really. We are talking about misinformation, not just any misinformation, but health misinformation. Somebody in the US, one leader in the US will call it fake news.
Fake. They have to leave that word. Fake. Phony. Fake.
I don't want to name names
Fake
because,
news?
They say the internet never forgets.
That's fair.
I don't want
fair.
wahala.
So, from WhatsApp broadcasts that told people to bathe in salt water during the Ebola outbreak to bizarre COVID-19 remedies like drinking garlic or even eating obscene amounts of bitter cola, false health claims have spread faster than some viruses, or even just as fast. Chibuike.
But yeah, it's what we're going to be talking about today, and it's around misinformation, right? But what do you call it? Does it have a local name? Like, what do you call it in your language?
I don't know if there's a word for misinformation in Efik, but sometimes when you know somebody is not particularly telling the truth, you look at them and you say, "Tengak panikofo." What? Tengak panikofo. And it's sort of to encourage them to stop telling lies and to tell you the truth. Yeah. How about you? In Igbo, is there any...
I don't know. I mean, lies is just in a tuashi. Like, you are lying, but
fair.
In terms of misinforming someone, I don't know. But maybe before we introduce our guest, or formally, we can also ask him. Sunday.
So for me, we don't have like a direct word for misinformation, but while I was in school, there's this thing there are people we call frank talkers. So when you refer to them as frank talkers, you know that what they are telling you is actually wrong.
You have to take it with a pinch of salt.
Yes, exactly.
Just to be...
Wait, where are you from?
Yeah, exactly. That's what I was going to ask.
So I'm from Benue.
Okay. So that we know those that are, let it be on record, those that know
their language. Well done.
I leave it there.
But to help us break this down, because our rule here, break things down like, you rightly said, so all of us make sense of these issues and act better, demand better health for all of us, really. We will be sitting down, or we already sitting down. Really. You heard his voice earlier, but yeah, we'll formally introduce him. But yeah, we're sitting down with someone who has been on the front lines of tackling health information in Nigeria.
His name is Sunday Oko, and he is a program officer at Nigeria Health Watch and also the focal person on the health misinformation management project here in the organization. Welcome to the podcast, Sunday.
Welcome.
Hi, Asari. Hi, Chibuike.
Really, the hot seats.
Really a pleasure to be here, and I'm looking to the conversations.
Oh, you're super welcome. I feel like our producer should put like clapping sounds here. Okay.
For first timers sitting on the hot seats.
Yes.
So yeah, let's start from the beginning, really. What is health misinformation, and why is it such a big problem in Nigeria?
Yeah. That's a great question, Chibuike. And health misinformation really refers to false or misleading health-related information that is shared without the intent to cause harm. And by this, I will just give an example. We are all aware of those messages that people tell you for send to 10 people and get in 10 minutes and get 10 million, right? Those messages that you see forwarded so many times, right? Some of those messages just come from the fact that in our community we are wired to care for one another. So it's that intent to be your brother's keeper. They send those messages without the intention to cause harm. So that's actually misinformation. So they don't have that intent. But for disinformation, on the other hand, it's actually deliberately sharing health information, right, that is with the intent to cause harm. So there's just that thin line of difference between the two. One, you have the intention, the other, there is no intent to cause harm. And a typical example is just when you have issues around vaccinations. For example, during the HPV campaign rollouts, we had disinformation from anti-vaxxers, people that say, oh, this vaccine is put out to make girls infertile. So that's deliberately sending out false information to cause harm in the community. So that's basically the difference. Yeah. Thank you.
So someone would just wake up and decide to
just for fun
and just decide to be mischievous.
Exactly.
Interesting. So how does it spread really, and why? Why do you think it continues to spread?
So for that, I'll try to bring in context. So for us in Nigeria, health misinformation is a major issue because of the fact that we are interconnected. Technology helps this spread as well. The fact that you're able to sit in your room and tick all your contacts, and just by a single button you can forward a message, that helps with the spread as well. And it's a two-way thing. You can use it to good and you can use it for ill as well. So in terms of how misinformation spreads, technology helps it. The fact that we are interconnected, where I trust my next door neighbor, he brings a word of mouth information and tells me that, oh, have you heard that salt water can cure so and so. And so that interconnectedness, we're in the generation where people rely mostly, everybody is a doctor, to be honest. So I put out a quote on Twitter and several comments, people with different opinions. So that's also fosters the spread of wrong information. Yeah, and that gap in knowledge is also something. Misinformation thrives where there is a gap, right? That information void. And like we all know, if you're a science person, you know that there is no empty void. Something must occupy it. So when there's that gap in knowledge, people don't understand something. Someone will always bring an opinion just to cover it. Yes.
Like they say, nature abhors vacuum.
Vacuums, yes. But so in the case of this Gary and Cook myth, what gap was being tried to fill? Because I cannot for the life of me understand why it is something that all of us have heard.
Well, I wouldn't say I know it all, why that's what gap he was trying to fill, to be honest. But what I feel is, so maybe someone took it and something happened, right?
Fair.
And then that way, someone then took up that information to say that, maybe this is a norm, right? Yeah. And it's stuck because you know how there is that feeling that you get when maybe something happened to someone and he shares it, you'll be willing to share it with another person.
Fair.
And
that actually makes sense because something can happen, just like you said. Maybe someone actually took it and
something happened to them.
But then there are other contexts.
Exactly.
Maybe there's something else going on that
maybe
of course
they
you
were
didn't
diabetic. Maybe
exactly. So you just came up, made that had that conclusion, and it spread from there. And
that's
it's
incredible.
Going from generation to generation.
Okay, so now, how do you get people to trust the accurate information, especially when misinformation travels faster and feels more sensational?
Yeah, so building trust is really critical to tackling misinformation. We have seen this very clearly in the work we currently do at Nigerian Health Watch, because without trust, people are they are not going to believe what you said. The issue around vaccine uptake in Nigeria is the hesitancy we are seeing is because people have lost trust in the government, right? It comes not just in health. For instance, if a government promises to tar a road, right, and then 4 years passes, right, and they don't do it, right, the same government is now telling you, oh, I'm bringing nets, I'm bringing vaccines. How do you want to divulge the two, right? It's kind of tricky to put, if you don't trust someone in a particular way, it extends to the other way. So building trust is really important, and that's why we are using multi-pronged approach. For us, what we do in Nigerian Health Watch, the work we currently do, we're using evidence-based methods to build trust, and by building trust is just being a credible source of information, consistently sending out the right information.
Wonderful. Okay, so can you take us back to a time when misinformation caused serious harm?
Absolutely. So one of the most notable examples of harm caused by misinformation in Nigeria actually was during the 2014 Ebola outbreak. I've already mentioned a bit of that, where a rumor spread rapidly that bathing with and drinking salt water could prevent Ebola. The first claim led to a lot of people being hospitalized, and sadly, there were even some who lost their lives, right, due to excessive salt consumption. That incident showed how quickly misinformation can escalate really into a public health crisis. Then also, we remember COVID-19 pandemic. The scale of misinformation even doubled during that time. Right. It was really alarming. We saw like widespread rumors about vaccine. People even believe that it was a tool for population control, or that it will alter our DNA, something around that. Others turned to unverified treatments like chloroquine. Chibuike mentioned something about that when we started.
Remember chloroquine?
Yeah. And this led to overdose. Many people had overdose, and it promoted untested herbal remedies. I remember there was this particular video I saw where someone had to build like a heater machine where he went in, locked up himself, and said he was protecting himself against COVID.
I don't understand.
And when he came out, he was very all sweaty, looking
like he was in a sauna.
I'm telling you. So these were all false remedies to cure COVID-19. And what this did was just to create more panic, more confusion in the community and also around us. Yeah. So these are really two examples that I thought I should point out.
Yeah.
Thank you.
These are really interesting examples. And one thing you said, sometimes the misinformation even leads to more issues than the actual situation or disease outbreak, that the information is trying to, address. But yeah, let's also go beyond the issues. As you know, we're always very mindful of, looking for what's working, solutions beyond the issues. So can you tell us more about the initiative? You keep referring to the Health Misinformation project. How is it helping to stop the spread of misinformation?
As it comes communications and advocacy organization, Nigerian Health Watch has taken a multi-pronged approach to tackling health misinformation. One of our flagship initiatives is the Health Misinformation project, and housed in it is the Health Misinformation Fellowship, right, which seeks to build a network of advocates that fight misinformation. And the idea is just to build ordinary people's capacity to tackle health misinformation. So, for instance, part of the people we trained were people in the communities. We identified like community structures like community leaders, religious leaders, and the likes. And interestingly, we also had people from the people living with disability, because we found out early on that misinformation doesn't just spread within our own sphere. There's also a community of people who can't read the flyers we put in the clinics, who can't see those flyers as well. So how do you communicate misinformation amongst that community? So that's what we aimed to do also. So, and then we also leverage technology through the use of AI for something we call community listening. And it's an idea where you just rack as many conversations as possible and then filter for misinformation. But then this is done in a informed manner. So we target certain areas. Like, for instance, we can say we want to look out for misinformation around vaccines. So we gather conversations online and then filter them to see, what are people saying, and we have a system where we say which one to respond to, why do we need to respond to them. And then what this helped us to do is, as much as we are targeting community members through our fellowship, there's also an online community that we also need to reach out to, and we discovered that online is very important as well. So using all this multi-pronged approach, we are able to reach different people using different formats and methods. So, like I said, we also engage in radio jingle production as well. We have like a series that we developed. It's on YouTube. It's called The Medics. It was from certain misconceptions we found out online, and then we developed a script and then was produced as a web series. So far so good. We've been using multiple methods to address misinformation.
That's very interesting. Thank you very much, Sunday. So what about the average person, right? Me and you and the rest of us who have Twitter accounts, who like receives misinformation almost on like a daily basis, right? What should we do?
Yeah, so the calls to action, misinformation is not a communications issue, right? It's a public health, I'll call it a public health emergency. So during the COVID-19 pandemic, WHO declared the whole COVID-19 not just a pandemic, but an infodemic, meaning there was a lot of of information going out there, whether right or wrong, right? So it's actually an everybody issue, right? We stay in our comfort zone, even if you don't want some of this information, people just forward them to you unsolicitedly, right? So there are some that people forward to you, but like I said earlier, you have the opportunity to pause for a second and ask, what this person is sending me, is it actually true? Rather than just forwarding it, right? So you can take hold of that opportunity, and that's how the circle is broken. So the whole circle of information, there is the sender, there's the receiver, but in between is that place where you can question and ask, what I'm sending out, is it actually right? And that's where we come in as individuals, as community members. When you go to the marketplace where people are talking and Mama Bomboy says something around that you don't hear say or something, how do you respond to them? Can you just tell Mama Bomboy to say, okay, please let me walk up to my healthcare provider and ask, is this thing true? Is it true that if you take mango and coke that you will die? Is it true? I mean, rather than testing it, why not go and ask first, right? So those are some of the things we can do as individuals to stop the spread of misinformation. So actually querying almost everything that you come across.
Yeah,
very important.
Like having that critical thing.
I think I'm like the other side of, or like the other extreme end of receiving any broadcast or any misinformation. So whenever anything is mass forwarded to me, I don't even bother looking at it, because whatever it is inside, like whatever it has inside it, I'm probably not interested in it.
Yeah, but I think that's even changing now. Some of these platforms, Facebook, Twitter, they have these restrictions now where you cannot forward to more than 5 people, just helping to reduce some of this thing. And the whole community project on X, all of those are meant to sort
community
notes. Yes, right. They are meant to guide all of this kind of issues. So the world is growing more aware of misinformation. Recently, a study came out, and it was a study by World Bank. It was a risk perception survey, and it was stated that misinformation is now ranked almost the second, just above even things like climate change, above things like wars and the rest. So you can see the scale of what we are dealing with here. So like Chibuike said, even the fear of, so you can contain diseases, right, in a certain way. Like when COVID came out, you could keep people in isolation centers, but misinformation cannot be contained. What we can do is actually manage it. no matter what you think, you are trying to protect it. Someone, like when someone dies and you don't want to tell family members, someone from somewhere can just randomly call and break the news that you were trying to protect all the while. Yeah. So misinformation is something very critical at this point in time.
Yeah.
Yeah.
You know, when you said when you mentioned something, the sender, the receiver, I almost added the forwarder.
Yeah.
But yeah, I mean, the people you talked about, we actually reached out to a couple of them, those who were part of the Health Misinformation Fellowship, and here's what they had to say about, the experience.
The fellowship program was very insightful.
Hi everyone, my name is Norm Ihoma, and this fellowship has been a learning experience.
Hi, this is Joshua Sule. The fellowship has been impactful. It has been an eye-opener indeed.
Hi, my name is Adamalani Yusuf, and the fellowship has been transformed.
Hello everyone, my name is Odinaka Kingsley Obeta, and I'm a fellow of the Nigeria Health Watch Health Misinformation Fellowship. Thank you so much for giving us the opportunity to be a part of this fellowship. Nigeria Health Watch has been an amazing time.
Judging from what we have done so far, I can say that this fellowship has been a success.
Hi everyone, my name is John Paul Obina, and this fellowship has been very amazing.
Hi, I'm Stephanie Omaribun, aka Lab Coat Girl, a 2024 Health Misinformation Fellow with Nigeria Health Watch. My health misinformation journey has been an incredible journey so far.
Hi, I'm Ubani Confidence Mesama. The fellowship has been an exciting learning experience.
The fellowship program was very wonderful.
Hi, my name is Edet Wisdom, and the fellowship was...
As you can see, the fellowship was everything. Make sure that you're part of the next group. Until then, bye.
So yeah, it's really great to hear all their feedback and insight. It really shows the power of community and collaboration in fighting misinformation. It's not a one-person responsibility.
That's very interesting. So this episode isn't just about the problem. It's also a call to action. So whether you're a nurse, a teacher, or just someone who shares a lot on WhatsApp or even Twitter, X, you have a role to play in tackling misinformation online. So in Nigeria, we have policies like the Health Promotion Policy of 2019, which encourages the use of digital platforms for accurate health education while combating misinformation. So all of us have the opportunity and we have a role to play in doing all of that.
Yeah, but the fact that, it's the policy encourages the use of digital media to address misinformation doesn't mean we should abuse it. So we have to use it responsibly. So before you hit forward, before you share, just take a pause first, who said it, where did it come from, and if you are not sure, please don't share.
Yes. With great power, aka the internet, comes great responsibility. So please remember, reliable health information can save lives.
If you do come across any strange or health, rumors or information, please send us a voice note. We might feature you in a future episode. Yeah.
That's it for today. Thank you so much for joining us on this episode of Break It Down. Don't forget to subscribe, rate, and share this podcast with anybody and everybody you know. Yes. So if you'd like to learn more about Nigeria Health Watch's misinformation work, please visit nigeriahealthwatch.com.
So thank you so much for joining us on the show today, Sunday.
Thank you. It was a good time together here.
My name is Asari Ndem.
And yes, I'm Chibuike. Please remember, when it comes to your health, the truth always matters.